Hello everyone, my name is Mohammad Haizi bin Abdul Manaf. Welcome to Evidence-Based Practice course. This is the first module. The first module is the introductions to evidence-based practice. Learners should be able to describe the purpose of evidence-based practice in physiotherapy practice and describe the 5 steps of evidence-based practice, including identify questions, search the evidence, appraise the evidence, and integrate the evidence with the clinical practice, and also by the end of the day evaluate the effectiveness of the um, interventions or activity related to the patients. The definitions of evidence-based practice is a method of clinical decision making and practice that integrates the first, scientific research evidence, number 2, clinical expertise, and number 3, patients' unique values and circumstances. So the purpose of evidence-based practice is to enhance the quality and credibility, enhance confidence and ability to assist patients in choosing their best options for physiotherapy care, and number 3, move the physiotherapy professions away from practice based on habit and towards a careful, systematic assessment of the best available evidence to inform patient care. So based on this case study, consider that Encik Akmal or Mr. Akmal is a 23 years old badminton player who've been referred to your outpatient physiotherapy clinic for knee pain for the past 3 days before the University Badminton Tournament, in which he is scheduled to compete. Akmal and his coach will expect you, as the expert of movement or the physiotherapist, to be able to answer their questions. Akmal might ask you, why does my knee hurt? What are the chances that I will be able to play without pain in 3 days? And what will you be able to do to help me to get better? So based on the case study previously in the previous slide, so we can find the evidence based on the scientific research. So the scientific research evidence is empirical evidence acquired through systematic testing of a hypothesis. Therapists assess two general types of scientific research, two general types of scientific research might include clinical research and including basic science research. So clinical research involves human subjects and answer questions about diagnosis, intervention, prevention, and prognosis in relation to disease or injury. So meanwhile, the clinical expertise is referred to implicit and explicit knowledge about physiotherapy diagnosis, treatment, prevention, and prognosis gained from cumulative years of experience or cumulative years of caring for patients with disease and injury and working to improve and refine that care. Professional clinical expertise is passed from clinician to clinician in the form of academic setting, post-professional education such as continuing education courses, residencies, practical clinical visit, clinical training, formal mentorships, and informally between colleagues. And what is about patient's value and circumstances? Patient values include the belief, preferences, expectations, and cultural identifications that the patient brings to the therapy environment. Therapists will encounter patients with diverse values that affect their physiotherapy care. Meanwhile, patient's preference refers as it serves as important evidence for guiding treatment decision. Evidence-based process including 5 steps in judging the evidence and determining the circumstances and patient values for guiding applications. Number 1, the first step will be identify the need for information and develop a focused and searchable clinical questions. Step number 2, researcher or clinician might conduct a search to find the best possible research evidence to answer your questions. Step number 3 include critically appraise the research evidence for applicability and quality of the research. Number 4, integrate the critically appraised research evidence with clinical expertise and the patient values and circumstances. Lastly, evaluate the effectiveness and efficacy of your efforts in step 1 to 4 and identify ways to improve them in the future. For step number 1, might include the formulating questions about the effects of interventions. It can be break question into 4 parts using PICO guide. PICO means that P equals to, it means that involve the patient itself or the population that you would like to study. For example, individual with low back pain or individual with post-stroke. I refer to interventions or management strategy that are related to the population or conditions. C is the comparative intervention, and O will be the outcome. For example, pain, or maybe the walking performance, or maybe functional mobility among patients with stroke. For step number 2, we perform searching the literature. The simplest way to do it by using Google Scholar or other search engine based on your clinical questions in the search box by using the PICO strategy. Okay, we can include all the components of PICO, the patient itself, intervention, comparison, treatment, and outcome interest in the search box. And this is an example of searching the literature using the PICO. P refer to population itself, ACL, patient with ACL, acute, not acute, anterior cruciate ligament injury. I refer to operative management. C as a comparative non-operative management, and O outcome refer to return to sports. And based on this search item using PICO, we can search into the Google Scholar, and there will be a lots of hits, okay, that related to the keywords have been put in the search box. If you can see from the result of the search, okay, we can see the bold color. Okay, this is for example return, because we have the words of return to sports. Okay, and then we have the operative and versus non-operative, and this is the P, the population itself, the anterior cruciate ligament. So you can see here, okay, all the keywords have been keyed in the search box will be displayed as a result of the searching. So we as the researcher or person that conduct the searching, we can identify which are the people or the evidence that suitable and related to our population or our case study related. So how do you search the internet for evidence? Okay, sometimes because we have a lots of combinations between the populations and between the intervention, comparison, and outcome, we can combine the search terms using the Boolean operator. So let's say for example we are combining between ACL and ACL and operative management, for example. Okay, it shows that you might narrow your search. Okay, or otherwise you can have the depression and exercise. So it means that you want the keywords focus on any papers related to depressions and also exercise. So meanwhile, let's say you want to broaden your search, you can use all. Okay, means that either you want to have educations or you want to have training. So means that the search become broader. Okay, some of the people that have the education keywords might appear in the search results, or papers related to training keywords also appear. So the hits might be more than if you are using a narrow or if you are using AND as your Boolean operator. So you can see maybe by using AND you might lesser paper, but if you're using OR, you might have lots of paper hits in that search. So let's say if you want to use NOT, means that might exclude the term that related to not. For example, human not animal. So this paper, the search, by such a paper, all the paper related to human, not the animals. After you find the papers, okay, all the papers in the search as a result of your search, first select only intervention study. If your aims to find paper related to intervention study, for example, you want to see the effects of any equipments or any electrotherapy equipments, so therefore you need to find the intervention studies. Number 2, check the studies. Okay, checks for studies that match your question more specifically. So let's say, for example, you are focusing more on ACL populations, and then you want to focus, for example, operative, or maybe using ultrasound, or maybe using shockwave therapy. Then you should check the study that match all the keywords that you want. And then lastly, use hierarchy of evidence to select the highest level of evidence. So this is the hierarchy of the evidence. The highest level of ranking of evidence is the systematic review. This is related to the research evidence pyramid for intervention study. So the highest ranking is the systematic review, especially systematic review with meta-analysis. Second one will be the single randomized clinical trials, single paper related to randomizing clinical trials. Or you can go further lower, which is the cohort studies, case control studies, case series, case studies, and also the narrative review or expert opinion or textbooks. So after you have been searching, okay, the evidence, and you found that evidence is related to your questions, the next question you would like to ask yourself is, how can I trust the evidence? How can I trust the evidence? So the next step will be, the third step will be the critical appraise the evidence. So critical appraisals is the process of reviewing, assessing, and interpreting evidence by systematically considering its rigor, results, and relevance to your own area of practice. So the step 4 include the integrate the appraised evidence into the clinical practice. You might use the evidence that's suitable for your research questions, and then you apply the technique or the treatment to the patient based on recommendations by the evidence. And after that, the step 5, you need to evaluate the effectiveness of the interventions. So you can see, is it same as the reported by the evidence? For example, that patient might improve after 6 weeks of training, and or a cumulative of 18 sessions. And how about your patients? The patient improve exactly the same as the paper. Maybe that you might have adjust, or maybe you modified the intervention that might cause that the patient require a longer time of recovery as compared to the evidence. As the conclusions, evidence-based practice is defined as the integrations of the best available research evidence with clinical expertise and patient unique values and circumstances. So the purpose of evidence-based practice is to use the best available evidence from all sources to optimize our patient benefits from physiotherapy perspective. There are 3 principal sources of evidence for evidence-based practice. Number 1 will be research evidence, number 2 clinical expertise, and number 3 patient's value and circumstances. So for the next module, we will discuss about how to perform properly. The first step will be how to develop clinical questions and how to search the research evidence. Thank you.